Etanercept is a protein therapy based on the binding fragment of the tumor necrosis factor alpha receptor used to treat severe rheumatoid arthritis and moderate to severe plaque psoriasis. In this video, let's found. What is Etanercept? What is Etanercept used for? Contraindication. What are the side effects of taking Etanercept? How does Etanercept work? How to use Etanercept? What is Etanercept? Etanercept, sold under the brand name Enbrel among others, is a biologic medical product that is used to treat autoimmune diseases by interfering with tumor necrosis factor, a soluble inflammatory cytokine, by acting as a TNF inhibitor. It is on the World Health Organization's list of essential medicines. What is Etanercept used for? Etanercept is indicated for the treatment of moderately to severely active rheumatoid arthritis in adults and in chronic moderate to severe plaque psoriasis in patients 4 years of age and older. It is also used to manage signs and symptoms of polyarticular idiopathic arthritis and juvenile psoriatic arthritis in those aged 2 years and older. Etanercept is also used to manage the symptoms of psoriatic arthritis and ankylosing spondylitis. What is Etanercept? Etanercept, sold under the brand name Enbrel among others, is a biologic medical product that is used to treat autoimmune diseases by interfering with tumor necrosis factor, a soluble inflammatory cytokine, by acting as a TNF inhibitor. It is on the World Health Organization's list of essential medicines. Side effects: loss of energy or weakness, nausea, pain or burning in the throat, redness or itching, pain or swelling at the injection site, under the skin, runny or stuffy nose, stomach pain, vomiting. What is Etanercept? Etanercept, sold under the brand name Enbrel among others, is a biologic medical product that is used to treat autoimmune diseases by interfering with tumor necrosis factor, a soluble inflammatory cytokine, by acting as a TNF inhibitor. It is on the World Health Organization's list of essential medicines. Mechanism of action. There are 2 distinct receptors for TNF, TNFRs, a 55 kilodalton protein, P55, and a 75 kilodalton protein, P75. The biological activity of TNF is dependent upon binding to either cell surface receptor, P70 or P55. Etanercept is a dimeric soluble form of the P75 TNF receptor that can bind to 2 TNF molecules, thereby effectively removing them from circulation. Notably, Etanercept is only capable of binding to the active trimeric form of TNF as its binding site is located in the cleft between subunits. TNF is a naturally occurring cytokine that is involved in normal inflammatory and immune responses. Increased levels of TNF are found in tissues and fluids of those with rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, and plaque psoriasis. Half-life. Etanercept has a mean half-life of elimination of 102 hours in RA patients. Dose. Ankylosing spondylitis. Enbrel, Erelzi, Eticovo. Indicated for reducing signs and symptoms of active ankylosing spondylitis. 50 mg SC once weekly. Rheumatoid arthritis. Enbrel, Erelzi, Eticovo. Indicated for reducing signs and symptoms, inducing major clinical response, inhibiting the progression of structural damage, and improving physical function in patients with moderately to severely active rheumatoid arthritis. 50 mg SC once weekly. Psoriatic arthritis. Enbrel, Erelzi, Eticovo. Indicated for reducing signs and symptoms, inhibiting the progression of structural damage of active arthritis, and improving physical function in patients with psoriatic arthritis. 50 mg SC once weekly. Plaque psoriasis. Enbrel, Ovo. Indicated for adults, greater than or equal to 18 years, with chronic moderate to severe plaque psoriasis who are candidates for systemic therapy or phototherapy. Initial, 50 mg SC twice weekly for 3 months. Maintenance, 50 mg SC once weekly. Safety advice. Use of Etanercept in pregnancy has been studied in around 1,200 women. There is no suggestion that Etanercept affects the baby's development, but ongoing data collection is ideally required to confirm this. Etanercept used in later pregnancy can potentially affect the baby's immune system for several months after birth. Dose: ankylosing spondylitis. Enbrel, Erelzi, Eticovo. Indicated for reducing signs and symptoms of active ankylosing spondylitis. 50 mg SC once weekly. Rheumatoid arthritis. Enbrel, Erelzi, Eticovo. Indicated for reducing signs and symptoms, inducing major clinical response, inhibiting the progression of structural damage, and improving physical function in patients with moderately to severely active rheumatoid arthritis. 50 mg SC once weekly. Psoriatic arthritis. Enbrel, Erelzi, Eticovo. Indicated for reducing signs and symptoms, inhibiting the progression of structural damage of active arthritis, and improving physical function in patients with psoriatic arthritis. 50 mg SC once weekly. Plaque psoriasis. Enbrel, Ovo. Indicated for adults, greater than or equal to 18 years, with chronic moderate to severe plaque psoriasis who are candidates for systemic therapy or phototherapy. Initial, 50 mg SC twice weekly for 3 months. Maintenance, 50 mg SC once weekly.